Welcome back to another edition of Quinte Connection as we continue to bring you up-to-date information with all the different organizations in the Quinte region and what's happening with flu season now upon us as well. Coming up shortly in the program, more about safe alternative ways to get outdoors and still stay safe and physically distanced. But joining us representing Hastings Prince Edward Public Health is the Medical Officer of Health, Dr. Piotr Oglaza. Dr. Oglaza, thanks so much for coming back on the program. We appreciate it.
Thank you for having me.
How's everything going so far?
As you can see with what's happening in the province, we are looking at increased case counts across the province. We are seeing more case counts coming in our region. And with that in mind, it is absolutely critical that we do all we can, first of all, to prevent further spread of COVID-19 in our area, as well as protect ourselves against other circulating pathogens, respiratory pathogens that are still circulating, they're still present, they have not gone away despite COVID being much of a concern these days. And I'm speaking about influenza, and I strongly encourage everyone to, if they haven't thought about getting influenza immunization previously, this is the year to get it. If there was ever better time to get influenza immunization, it's this year.
So walk us through the flu shot, Dr. Oglaza. How is it kind of determined what they put in it?
So each year, decisions are being made what goes into the flu shot based on the experience from the other hemisphere. We know that influenza virus circulates around the world, and cold and flu season in our part of the world, in the northern hemisphere, is again fall and winter, early spring, whereas other parts of the world, it is the opposite. They're in the south, they have different cold and flu season. And each year we see that flu makes a comeback. It's a recurring epidemic that we see. And each year the virus changes slightly. So when scientists across the world are looking at sort of decisions, what should go into the vaccine, they look at the circulating pathogens in other parts of the world, and then they make a decision which pathogen, which strains, which types of flu virus should be a basis for the protection for the upcoming influenza season. So we always have our vaccine right now, the main product, the product that's recommended for everyone over the 6 months of age, is what we call a quadrivalent. Quadrivalent meaning 4. It has 4 strains of influenza, 2 of the A type, 2 of the B type. We know that influenza A is the most commonly circulating influenza strain. So there's 2 types of those. And I believe based on our year-to-year experience, it's over 80% of it, influenza is the type A, one or the other of the type A. So that vaccine prevents against that, these anticipated strains. There's also influenza B, which is, again, it's a slightly different type of influenza. It peaks a little bit later. With influenza A, we see a traditional peak around the end of the year. So end of December, beginning of the new year, that's where we see most of influenza activity. And that's based on the influenza A. Influenza B usually peaks later in the spring, and compared to the influenza A, it's a much smaller blip on our epi curve. So again, but it will still provide that protection against the 2 likely strains of B. We know that individuals over the age of 65, older adults, are less susceptible to influenza B. We know that influenza B is the pathogen that mostly affects children. So that's why the product that's for 6 months or older would have 2 different kinds of influenza B, 2 different kinds of influenza A. Whereas there's also a different product that's specifically designed for older adults that is trivalent, which is just 3 component. It doesn't have one of the B strains, but instead it has a higher dose of the strains for A and that one B. So basically it is intended to theoretically provide maybe a stronger immune response to those who may not have a strong immune system to begin with. Again, there's not much evidence at this point to say whether someone immunized with the regular product versus the high dose product, if someone is, let's say, over the age of 65, is eligible for the high dose product. If that person, basically, there's not enough research to tell yet head to head who is going to get it, who is going to be protected better, but theoretically that high dose is intended for older adults. So that's sort of very quick overview about why we have different influenza products, as well as what goes into the decision which strains are present in those vaccines. And one thing also to make clear, there's no live virus in any of the vaccine that's available. These are all just like bits and parts of influenza virus that are then used for the immune system when we get immunized, when we get injection with that vaccine. Our own immune system is then practicing and developing defense mechanisms, the antibodies. So then if the real virus come in, we're already prepared how to fight it.
Good information to know. Now, what about if older individuals can't have immediate access to the higher dose of the flu vaccine? What's the recommendation?
So definitely this year, as any other years as well, the recommendation is not to delay influenza immunization to wait for that high dose product. The recommendation is to get immunized, get protected with whichever product is available at the moment. It's better to get the protection with the regular product than wait if the other one becomes available, because again, by that time, we might already become exposed to influenza, and then we have no protection. So I would not, I would recommend that individuals seek immunizations with the product that's available.
And Public Health's website has a wide variety of resources. They are literally available quite everywhere. Trenton, Tweed, Picton, Madoc, Marmara, Frankfurt, Belleville, Bancroft, you can get access to a flu shot. Dr. Oglaza, how has it been for Hastings Prince Edward Public Health making sure we have enough stock with the flu vaccine? What's the material?
So the vaccine comes, we are distributing vaccine, local public health distributes vaccine to long-term care, retirement homes, hospital, and also primary healthcare providers. The pharmacies get their stock directly from the government pharmacy through the third-party suppliers. So, so again, I don't have the total overall numbers, but anecdotally, I can hear from the community there's increased demand for influenza vaccine.
Okay.
And again, just to add to the previous comment, influenza immunization is available right now through a variety of ways. And again, that's along the lines of what's recommended internationally. The more places and opportunities for people to get immunized, the more likely people will get immunized. So that's a recognized strategy coming from World Health Organization. And we also know that people sometimes may delay immunization based on simple things like convenience. So that's why immunizations are available through pharmacies, are available through healthcare providers, primary care healthcare providers. And we also are offering some vaccine through public health to those who do not have primary healthcare providers, as well as specifically to those who are under the 5 years of age, because we know the pharmacies would only immunize children over the age of 5. So that's one important thing. Anyone above the age of 6 months should be eligible to get influenza immunization, but some of the locations for participating pharmacies generally they are not able to give vaccine under the age of 5.
Okay, so with that, Dr. Oglaza, as we enter the cooler months, what's your recommendation with Halloween fast approaching?
Very good question with regards to Halloween. We know that Halloween is one of these holidays and celebrations where people would traditionally be gathering and maybe participating in these walks around the neighborhood, trick-or-treating, coming to the door and getting candy. These are all the traditional, conventional trick-or-treating activities. We know that with the increase of COVID cases across the province, again, even though our area has been relatively spared, it is in the spirit of all the other measures that we have in place to recommend against conventional trick-or-treating. We do things very differently this year. I remember last year we had a conversation face-to-face in the studio. Now we are talking over Zoom. We are limiting non-essential face-to-face interactions, and this is along the same lines. It could be done. Trick-or-treating could be done in a way that minimizes risk, but if at all possible, we are recommending to consider alternatives, such as look at the virtual ways, maybe having a walk around the neighborhood to look at the decoration, have a scavenger hunt on one's in one's house or property. These might be good alternatives to consider this year.
And you've got kids at home, so very much similar to the Thanksgiving recommendations. How have you been managing everything? What are some of the ideas you've been trying to keep your family busy with?
So that's a very good question, because people know that there's a strong there's a strong expectation that children will be going trick-or-treating, and it's something that, again, should be presented as a fun, engaging alternative to the conventional activity. Again, whether it's a scavenger hunt or another way of celebrating, that might be a good alternative. What we also have to be mindful is that with trick-or-treating, it's two ways. It's parents, children going out around the neighborhood looking for treats, but it's also other individuals in the neighborhood who may not be comfortable interacting. They may not have a setup, they may not be comfortable interacting, and we have to be mindful and respectful of that. We made some suggestions what people can do to opt out of giving out candy, and we know that, especially with the population of older adults, we know that they enjoy often giving out candy to kids, but with what's happening with regards to the COVID-19 pandemic, they may not be comfortable having people coming to the doorstep. So we have to be mindful and respectful of that.
And we certainly are adjusting going forward. One thing, though, I did want to ask you, Dr. Oglaza, is we heard the province had listed a Shoppers Drug Mart in Belleville as one of the locations offering COVID-19 tests to, say, asymptomatic individuals. Could you walk us through what's happening right now?
Certainly. So the key point here is that it's testing for asymptomatic individuals. So generally, when we talk about COVID-19 testing, we're talking about testing individuals who either have symptoms or otherwise at higher risk, and testing is directed by public health. Generally, we discourage asymptomatic testing. It has limited value. It might be a false sense of security. But again, we recognize that there's some programs, some regulatory requirements where people have to present with a negative result in order to gain access to, let's say, long-term care home. So again, these are some of the circumstances in which the asymptomatic testing might be considered. So if someone is in that category that they need to have a test and they don't have any symptoms, they could call, make an appointment, and they'll have the swab done. And they'll be receiving results. Again, this is something that avenue for testing is handled by participating pharmacies. So again, they would have more information with regards to how this is all done.
What's your recommendations now with, we're dealing with COVID-19, but also flu season? What are some of the big differences that you would recommend us watching out for if we don't feel well, but we may not feel that we've been exposed to the virus? What are some of the differences between COVID-19 and the flu?
The most challenging part here is that really there's no set of symptoms or single symptom or set of symptoms that could reliably allow us to distinguish between COVID-19 and other respiratory viruses. So in the past, we were generally saying that if you feel really sick, like you've been hit by a train, and you can feel a sudden onset of that illness, that's most likely influenza rather than the seasonal cold virus. Again, this is not something that may give us any level of prediction with regards to COVID. We may definitely not be able to distinguish between a regular cold virus and COVID-19 because symptoms range. They could start with fairly mild symptoms as well. So the recommendation is that for anyone who feels that they are coming down with a cold, my recommendation is to self-isolate and seek COVID-19 testing.
We're all the same team here, though, with the pandemic going forward. How have you felt with the response of this community, as we have seen a bit of an uptick in cases locally, but overall, we've been quite fortunate here?
It's quite amazing that the community embraces the very, very hard reality of having to deal with so many restrictions and changes to our day-to-day activities. It's something that I believe strongly that kept us safe so far. And even though we will see more cases, likely, I think everyone is doing their part to reduce that risk of the spread. And that's, again, going back to that recommendation, how to look at celebrations of holidays such as Halloween. This is part of that joint effort to make sure that we minimize the risk of transmission and keep our community safe, keep our local transmission low, and move forward.
How do you feel about the holiday season right now? Of course, super early to tell, but we've got already this happening at the moment.
Definitely, this is most likely going to be a year where holiday celebrations will be different, and I would use Thanksgiving as a comparison. It's basically something that I can anticipate that the advice will be to keep it to a close circle of the same household.
All right, so finally over the summer we got introduced to Dr. Oglaza and Dr. Ethan Toumiche in your role briefly. Where are they now? Where are those two doctors within the Hastings Prince Edward Public Health team?
So these doctors, they have moved on to other opportunities. I believe Dr. Toumiche is back in Kingston doing a rotation there as part of the Public Health Preventive Medicine residency program, and Dr. Oglaza has moved and got a position within Toronto Public Health.
All right, and we certainly wish them well. Dr. Piotr Oglaza, before we leave you, could you just remind us where to go with all this information, especially with the flu shot?
Absolutely. So please do visit our website, hpepublichealth.ca. Again, if you have questions about the flu shot or want to book an appointment, the best place to start is your primary healthcare provider. You can check with your pharmacy as well, and you can check with us, Hastings Prince Edward Public Health, hpepublichealth.ca.
And are staff at the health unit still accepting a limited number of people in the building, whether that be immunizations for school or things other like that? What's the status with people entering the building?
So there's some these critical services, some of these important services still continue. They're by appointment only, and again, we are looking at the situation and there's screening and want to make sure that that we follow the same recommendation as the rest of the healthcare system when it comes to face-to-face clinical encounters. But again, things are very, very different compared to what it used to be last year.
All right, Dr. Piotr Oglaza, the Medical Officer of Health with Hastings Prince Edward Public Health, wishing you and your team well, and thanks so much for continuing to keep us safe. Really appreciate it.
Thanks so much.